This presentation will be an introduction to advocacy, highlighting the individual and structural issues and barriers through the reflections of my placement at Headspace Craigieburn, using a social work perspective. I'll also be reflecting on the current COVID context and how this context has impacted on young people and the current structural issues that have developed in response to the changing COVID context. Headspace is a primary mental health service that is free of charge and aims to intervene early in the development of mental ill health for young people aged 12 to 25 years by breaking down the barriers to service access experienced by adolescents and emerging adults and providing holistic healthcare to cater for young people's needs. Through implementation of these core components, Headspace aims to provide easy access as a one-stop shop for youth-friendly mental health, physical and sexual health, alcohol and other drugs, and vocational services for young people across Australia. Headspace Craigieburn offers one-on-one counselling, psychiatry assessment and support, medical appointments, peer support, social groups, art therapy, brief intervention work, research, family therapy, alcohol and drug counselling, community events, after-school programs, training sessions for parents, and also has online platforms such as Instagram that do live Instagram chats and communicate psychoeducation and awareness. And we also have eHeadspace, which is an online counselling support. The program and team I'm situated in is the Access team, which consists of performing intake calls, completing assessments, which comprise of the traditional biopsychosocial framework and risk assessment framework. The Access team also coordinate the intervention planning and management of allocating the young person to allied health professionals for counselling or other support that Headspace offers. The Access team can also provide brief intervention sessions with young people, also known as BIC, which is influenced by the CBT, and that might focus on issues such as sleep, anger management, body image, and meditation, for example. The role of the social worker at Headspace varies. The Access team is made up of a multidisciplinary team, and all clinicians, despite their professional background, as Bland et al. 2015 describes, the Access team fits within a transdisciplinary model. That is, the Access team comprising of a range of professionals and places little emphasis on the members' different disciplinary backgrounds, and is organised in a way that everyone will do the same work essentially in the same way. Further from the Access team, social workers may also be found in the Enhanced Care Coordinator role, which holds a more case management role for more of the complex young people that come through Headspace. Other roles may also be a team leader and other senior roles as well. The main client group of the organisation is young people aged 12 to 25. It is acknowledged that Headspace is a voluntary service and does rely on the help-seeking attitude of the young person, with support of the young person's carer, parents, friends, and other support services involved. A young person can access the service through gaining a mental health care plan from their GP, which will enable the young person to access one-on-one counselling with one of the centre's allied health professionals. However, a young person, family member, or external organisation can call the Headspace Centre to refer a young person as well. Some common referrals we may get is from a parent or child protection, for example. When this occurs, we start the intake and assessment process, but the young person will need a mental health care plan to access the 10 counselling sessions provided by Medicare. The individual issues I'll be focusing on in this presentation is the stigma, judgment, and negative connotations that are associated with accessing mental health supports and/or the same discrimination and judgment associated with having a mental illness. I'll also focus on the extreme vulnerability young people have in relation to the emerging of mental health problems at their age, their reluctance to seek help, and I'll also focus on the population groups such as young males and young people from Aboriginal and Torres Strait Islander backgrounds that do not access Headspace centres as much as other population groups, which again can also translate as structural issues. The complexity associated with stigma can be viewed in a social work lens through a multidimensional construct, which highlights various aspects of stigma, such as personal stigma, self-stigma, perceived stigma, interpersonal stigma, discriminatory behaviour, and structural discrimination. The Headspace media release titled The Big Stigma, published in 2016, talks about the role of stigma and what role it plays in preventing young Australians from seeking help for mental health issues. Deborah Rickwood, the chief investigator of the research from Headspace, has found that 52% of young people were embarrassed to discuss a mental health problem with anyone, and nearly half were afraid of what others would think. If stigma is not attended to and worked towards breaking down, we will see a lack of people accessing the service. We will see young people will keep things to themselves and not seek help. We would see prevalence and suicide rates of young people increasing. Thus, it is extremely important to continue to decrease the stigma attached to mental health diagnosis and help seeking. Another issue is the high vulnerability young people have in relation to the emergence of mental health problems and their reluctance to seek help. The developmental stages that young people go through is a unique and formative time. Young people are at risk of developing mental health problems through exposure to risk factors associated with multiple physical, emotional, and social changes, including exposure to poverty, abuse, or violence that can make adolescents vulnerable to mental health problems. 3/4 of all mental health disorders commence by the age of 24. Therefore, effective early intervention is essential to prevent deterioration of mental health and to support vulnerable health problems to attempt to prevent the deterioration of mental health and well-being, and to support young people to transition to early adulthood. If there were no early intervention services like Headspace, we would be constantly viewing mental health at a tertiary, more crisis level, which is harder to manage and more likely to impact on the young person more greatly. Lastly, young males and Aboriginal and Torres Strait Islander people are two groups that aren't accessing mental health services or Headspace services, as opposed to other groups, or opposed to the female population. 1 in 7 men aged 16 to 24 experience depression and anxiety each year, yet a small percentage of 13% are seeking help from Headspace data. Furthermore, suicide is also the leading cause of death for young men in Australia. Young males have a harder time recognising the importance of maintaining mental health due to a number of reasons, such as the traditional gender role stereotypes, inability to identify early warning signs, as well as a reluctance to let anyone know. The lives of Aboriginal and Torres Strait Islanders are shaped by unique historical, socio-cultural, economic, environmental, and political factors that impact on their psychological and physical well-being. Available data has revealed that this population group are worse off than any other population groups and are higher risk of committing suicide and self-harm, as well as being afflicted by psychological illness. Unfortunately, by the time many young Aboriginal and Torres Strait Islander people are 12 years old, they will have experienced more trauma than a non-Indigenous person in their lifetime. Additionally, like the stigma experienced by young people as discussed before, there's also a sense of shame associated with help seeking amongst the Aboriginal and Torres Strait Islander community. Thus, these presenting challenges make it clear that there's a heavy demand for more mental health support to meet the unique needs of Aboriginal and Torres Strait Islander people. Linking the individual issues of the high vulnerability I just spoke about before, it can be translated into structural issues that emerges associated with the importance of early intervention. It also comes with the issue of maintaining that focus of early intervention. Purcell et al. 2011 acknowledged that it is an ongoing challenge because there's so much unmet needs for all stages of mental health intervention due to the lack of sufficient resources allocated to mental health care. This also links to another challenge of Headspace, which is associated with Headspace being a primary service and the grey area surrounding its secondary response. Although the funding is majority for primary services, Headspace does offer some secondary case management support for young people who sit in between that primary and secondary model. And that's what the Enhanced Care Coordinator, or ECC, role is. As Patrick McGorry describes in the article from The Australian in 2019, there is a proportion of young people that he has called the missing middle, which is which are that more than 1 million Australians with mental illness whose conditions are too complex or enduring for primary mental health care, but is not yet efficiently desperate to force their way into the tertiary state public mental health system. Thus, the so-called middle area of primary and tertiary needs to be addressed. Further on this point, Headspace does not provide a tertiary response to mental health. Therefore, some young people may access Headspace and want to engage with service due to its suitability and likeness for the service of the younger population group. However, means clinicians have to refer on to other services because they're too high for our threshold. And this can translate and create individual issues and barriers that ensure that young people are less likely to seek assistance, feel rejected from Headspace, and may increase their risk of being ambivalent or impact their help-seeking behaviour in the future. Furthermore, there are structural challenges in relation to the service capacity and the long wait list. I'll speak more to this when I discuss the COVID context later in the presentation too, but Headspace is a free service, so although it meets the needs of reducing financial barriers, it creates a larger waitlist to access counselling that the service struggles to effectively maintain, creating another barrier and issue within itself. In general, majority of the structural and individual challenges ultimately comes down to the lack of sufficient funding and resources to mental health care. We have seen a recent increase with the COVID context, as I discuss more soon, but overall, there is an insufficient funding to Headspace and the mental health in general to provide an accessible and barrier-free service. As a result of the COVID-19 pandemic and the impact it's had on the young people of not being able to go to school, participate in school activities, socialise and meet with friends face-to-face, has contributed to the detrimental individual effects and issues associated with young people's sleep, mood, motivation, and social isolation. As a result of these impacts, mental health and suicide prevention remains one of our government's highest priorities. As adapted from the media release on the 6th of August made by the Prime Minister, it highlights how the COVID-19 has resulted in a number of impacts to young people and highlights why the federal government has supported mental health and well-being of young people in Victoria by initiating a $5 million investment. The Headspace blog post in response to this has revealed that they have found 41% of young Victorians aged 12 to 25 felt that COVID-19 has impacted their confidence to achieve future goals, and that 55% of young people felt their mental health had gotten worse. Further, from a more recent media release, the Morrison government has also invested $5.7 billion into mental health, which doubled the support under Better Access from 10 to 20 Medicare-funded psychological services as a result of the forward estimates to deliver the essential health services Australians need under the long-term National Health Plan. As a result of the recent funding, resources and COVID-19 context, there are many more young people accessing the service and have less time to currently train up new clinicians and allied health professionals. At the moment, our waitlist to see an allied health professional is constantly changing, but it's looking up to be a 6-month wait in some instances for those who aren't on a priority category. Thus, the wait time and current service capacity is at an all-time high. This also translates into individual issues which can be explained through the ecological theoretical model, which suggests the timing of the young person accessing the service is crucial, that they're already in the ready mindset, and once assessed and allocated to see an allied health professional for counselling, it means they sit on a wait list for 4 to 6 months and may eventually lose interest in engaging, their risk and mental health presentation changing dramatically since their first assessment, and their risk to self-harm or suicide increasing whilst on the wait list. The Access team do not have the capacity to check in with all of those on the wait list, and some young people fall through the cracks by sitting on this long wait list as well. The community awareness and community engagement Headspace works towards is an essential part of the Headspace model, which strongly works towards the individual barriers of reducing stigma, judgments, as well as working towards increasing young people to feel comfortable to seek support. Examples of this type of work is the large social media platform, school presentations, outreach programs to schools, as well as micro work that the clinicians, social workers, and other professionals do when working with a young person entering the service. It is acknowledged that young people and their families, including society and community in general, need to be psychoeducated and gain a level of mental health literacy to be able to recognise when issues might need professional support, reduce the stigma of mental health problems, encourage a positive attitude to seeking help, and know where to go for appropriate support. It is acknowledged that the more people talk about mental health, we tear down stigma bit by bit, and the smaller stigma gets. Headspace is addressing the vulnerabilities and emergence of mental health problems for young people by its commitment to early intervention, which enables young people to access support as well as possible in the development of mental health problems. The Headspace initiative is based on the population health premise that only by intervening early will the burden of mental illness be reduced over time. It is also fundamental that intervening early is the best interests of the young people, their families and communities to provide appropriate treatment and psychosocial support to help young people get their life back on track quickly. Headspace also has a no wrong door policy, which means that no young person will be turned away. That is, if Headspace can't provide appropriate support, then the team will provide the young person with other appropriate pathways to external agencies. Headspace is also using the recent government funding in response to the pandemic to increase outreach into Victorian communities to ensure young people are supported both throughout this period and into the future via a range of in-person and online services. Services will be tailored to also support parents and guardians of young people and will work closely with school and other key networks that are within the young people's systems. Since Headspace has in the past been predominantly psychology-based, with individualistic ways of assessing, they have started to employ more social workers and OTs to even out the playing field a bit more. Therefore, there's more of a multidisciplinary approach. In my experience of placement, 4 new people have been hired, which are all social workers, and I'm the first social work student in quite a long period of time where they've predominantly had psychology students in the past, therefore hoping to expand their value base, theoretical understandings, and a more diverse and comprehensive formulations due to the more diverse disciplines within the Access team and other teams. Headspace is working to address the COVID challenges and pre-COVID challenges associated with the service capacity and long wait times through hiring of more professionals and through a relatively small priority system, which places those as a priority on the top of the waitlist to seek counselling. A couple of examples of these priorities are Aboriginal and Torres Strait Islander background, and if the young person's in Year 12, identify to be within the LGBTQIA+ community, or recent suicide attempts, for example. Clinicians also work towards trying to link the young person in with peer support, groups, brief intervention support, provision of self-help information, group programs, phone check-ins, or any other group services that Headspace offer to support them in the meantime while they're on the waitlist. Headspace is also working to address the COVID challenges and pre-COVID challenges associated with service capacity and long wait times through hiring of more professionals and through the relatively small priority system that places those as a priority at the top of the waitlist for counselling. Clinicians also work towards trying to link the young person in with peer support groups, social groups, brief intervention support, provision of self-help information, group programs, phone check-ins, or any other group services that Headspace offer to support them in the meantime. Headspace is also making up for the long waitlist and service capacity challenges by hiring more staff through some of the funding provided by the government. That is expanding the Access team, expanding the allied health professionals that do the counselling, as well as implementing more online services and platforms, such as the new platform called the Moderated Online Social Therapy Platform, also known as MOST, which provides youth-friendly modules, online workbooks, chats, and online counselling therapy for young people, which may be appropriate for young people to engage with while they're on the waitlist, thus decreasing the impact of the long waitlist that it currently has on them which is ready to be piloted at Craigieburn at the end of the month. Taking a human rights and social work approach to the structural and individual issues associated with mental health and headspace provides valuable insights to how we can address the contributing factors to ill health and strengthen the factors that promote mental health. The role of social work and using this lens can direct attention to the needs of vulnerable groups and to the interaction between discrimination and marginalisation on mental health and young people within Australia. It demonstrates the importance of many principles that underpin the service system, such as equality of access to services and the need for standards and accountability in the delivery of services. And most importantly, responding to these issues will increase the overall mental health of young people. The role of social work is important in mental health because it understands that mental health and mental illness are not caused or determined by a single factor. Social work uses a multidimensional person-in-environment approach. This focus is what distinguishes social work from other professionals such as psychology, who might use more individualistic type of assessment. When completing assessments, would hopefully undertake comprehensive and evidence-informed psychosocial assessments, which will include aspects and dimensions such as the individual, family, social, community, environmental, and cultural factors, and how these impact on development and well-being. Furthermore, social workers also highlight the importance of addressing a young person's needs, strengths, and goals through the influence of a strengths-based approach. Looking past the work social workers might do on an individual level with the client, our commitment to human rights and social justice means social workers will work to advocate for the rights of clients against discrimination, reduced opportunities, and other systemic vulnerabilities. Social work also has a lens that works towards addressing individual problems or issues as having structural and systemic relationships. And this translates a little bit to my presentation where I found it hard to separate the individual and structural issues and barriers due to the overlap and due to thinking critically of the individual experiences and how they can be translated structurally. It can be concluded that there are a number of individual and structural issues within the mental health system and headspace system that often overlap and intervene with one another. The social work profession is especially important in the advocating and are the best roles in identifying gaps, barriers, and other challenges people may face entering the service. Due to the context of social work and our value base of human rights, social justice, and equality. And I also have evidence of an extension as well. Thank you.